Okay, so first let's talk about AP spread. So AP spread is determined by measuring the most anterior implant and the distance to the most posterior implant. And with a traditional screw-retain, pro-arch, or hybrid type of restoration, we can go up to 1.5 times the AP spread. Now, in order to increase that AP spread, we can angle the implants to increase that AP spread. But we have to understand that this is kind of a general rule, and it really has to do with the size of the implants that we placed. What is the opposing arch? Is it a denture or is it natural dentition? What's the quality of the bone? Does the patient have parafunctional habits? What is the patient's bite force? Is it a little old lady or a big, strong construction worker? With LOCATOR Fixed, we want to limit that to 1 times the AP spread. And here's some examples on the picture on the left. We have good AP spread, and so we can feel comfortable about going 1 time the AP spread if it's a LOCATOR Fixed case. But on the right side, you can see that in one area we have a nice AP spread, but in the other area the implants are very close together, and we're going to have a shorter cantilever on that side. And if we have a poor AP spread, then we have to consider shortening the distal cantilever and having less teeth, or considering adding additional implant, like putting a small diameter implant more posteriorly. And this picture kind of shows you the restorative heights of a straight type of a LOCATOR abutment. And before we had the angled abutments, there used to be a option that we could put a sleeve and then screw in a LOCATOR abutment in order to I'm going to go back on that. I got to start this over.
Okay. You going to start with the work authorization?
No, right here.
Oh, okay. All right.
Okay, so more recently, Zest has added angled LOCATOR abutments to their line of products. And this picture kind of shows the height of the straight LOCATOR abutment. And then it shows the angled abutment. And you can see that we have, because of the way the angled abutments are, it requires a little bit more restorative space. Prior to the angled abutment, there was a special abutment that we could place onto a MUA, an angled MUA abutment, but it required this little sleeve here that really increased the height, the restorative height of that system, and sometimes it made it took up so much space that it wasn't reasonable to use it. And you can see how this system worked with the little sleeve that fit over the MUA abutment, the angled MUA abutment, that allowed us to parallel these LOCATOR abutments. And now with the LOCATOR angled abutment, we have a much better solution that can kind of get us out of trouble and allow us to have better AP spread. Okay, going further into my work authorization, I'm also going to say, please schedule an online meeting to review the digital design before milling. Mill in Ivosian monoblock, and prior to applying the pink tissue shading, adjust the occlusion until the articulator pin is returned to the position established by the aesthetic wax try-in. And we're going to go through these laboratory steps that'll make this make a little more sense. Also, I'm going to tell them to pick up the LOCATOR Fixed housings using the opposing wax setup and the struts to assure proper occlusion and maintain the established vertical dimensions set at the pin on the Stratos articulator. Then I'm going to ask them to apply Breadent Creoline gum to the flanges to match the light fibered pink Ivo base. And then I'm going to ask them to process the upper denture in IvoBase. And then we want to give them the implant information. These happen to be Straumann bone level RC. Okay, so they've scanned my setup, and they planned, as you can see in the green, the LOCATOR Fixed prosthesis. And you can see that the setup has additional teeth going posteriorly, but I always do that because it helps me with the position that I want those teeth to be in based on the anatomical landmarks, and so that I can have my upper denture teeth in the right spot. So it just helps improve the quality of the overall case. Now we have many different options in terms of materials. We can do monolithic zirconia, we can have a processed acrylic prosthesis, and we can reinforce it with metal framework. In this case, I'm using an IvoDent all-white option. Another option is the Ivotion monolithic bicolor, where the puck has both the pink and white. But I used the all-white in this case because, again, I wanted them to match that shade to the upper Ivo-based denture. Just a couple other corporate slides where you can have a chromium cobalt framework and process denture teeth to that. The middle is the monolithic zirconia. We can use polymer bars with milled polymer teeth like Crystal Ultra. We can have a 3D printed Lucitone or Onyx Tough prosthesis. And again, we can have the milled monolithic PMMA or Ivotion with layered pink composite. So here's our prosthesis after it comes out of the mill. And you can see those little fingers. You want to make sure the technicians don't cut those fingers off when they're removing it from the puck. And here's a little closer up of those fingers. So those fingers are going to sit on the land areas of the cast, so we can exactly duplicate the position of the teeth to replicate the position in my wax up when we're picking up the processing housings. So now we have our master model. I torque my LOCATOR abutments at the proper cuff heights to 25 Newton centimeters. And now we're going to verify the complete seating of the struts. You can see here that it seats perfectly with those fingers sitting on the model. And now the teeth are in the exact same position as the wax up. Now I'm going to place my processing housings with my white spacers to protect the cast from cement dripping down onto the implant abutments. And just to make sure that this still fits, I'm going to use a little green fit checker. I'm going to spray it into the wells of the prosthesis. And now I'm going to place it over the housings. And you can see here that we did not estimate properly the space we needed to pick up these housings. So once I take that off of there, I'm going to see where the binding is. I'm going to use a carbide burr to relieve the housings a little bit more. Usually takes me about 2 or 3 tries to get rid of any interferences. We use our chair side adjustment teeth kit, as you can see in the upper right corner. And now the prosthesis goes back into place. And as I said before, it preserves the vertical dimension and it preserves the occlusion to replicate what we developed in our wax up. Now we want to make sure it doesn't change our vertical, so I'm going to close the pin against the aesthetic wax triad. And that pin should hit the base of the articulator, and so I'm going to verify that by using a little shim stock. And in this case, the pin was not resting on that base. When you pull that shim stock, it pulled through, so that means our vertical dimension was increased slightly. So I'm going to mark the occlusion with my articulating paper, and you can see the little black dots where it's hitting, more on the posterior teeth. We're going to take a burr and enhance the occlusion, get rid of those little black spots, but not blow away our anatomy or our cuss tips. We're just trying to enhance the anatomy as we make those adjustments. Once our adjustments are complete and the pin is hitting the articulator correctly and our vertical dimension is correct, now I'm going to place a couple vent holes so I can decrease the hydrostatic pressure as I'm trying to pick up these attachments with my cement. I'm going to sandblast the housings, place a little monobond primer to improve the bond strength to the housings. Place my white spacers on the model with the housings. And then I'm going to use a little bonding agent in these wells, again, to improve the bond between the housing and the prosthetic. In this case, we're using Reliax Unisem 2. So we're going to place the cement, fill it up about 2/3 the way. Add a little bit of material over the housings to make sure we have a good dense amount of cement holding the housings in. And then we're going to seat the prosthesis on the model, make sure those fingers are touching the land area, remove any excess cement, close the articulator against the wax try-in to make sure that bite is just perfect, and then we're going to light cure. Now in this case, in this slide, I'm using the locator removal tool just as a demonstration to show you how you remove these in the mouth. In the lab, I would probably just use a lab knife to pop the prosthesis off. But again, this is just to show you how you can use this tool to remove the prosthesis in the mouth at your recare appointments. So we've completed the pickup. Sometimes we could have some little voids in the intaglio around those processing housings, so we could take our flowable material, make sure that there's no little air bubbles so that we have a nice cleansable intaglio of the prosthesis. Throw it in a light curing unit to make sure it's fully cured. And now that we have our processing housings in place, now we can cut off the struts because we don't have to go back to that model anymore. So now we've cut off the processing housings, and now we're just going to smooth off any little bumps or edges, make the prosthetic just very smooth and cleansable. And then we're going to use some discs to enhance the incisal embrasures and make the prosthetic as aesthetic as possible, so it looks like individual teeth. Now we're going to do a little further refining to make the cervical areas nice and clean. And then just outline the cervical areas so we know where the pink and the white are going to end. Do a little further refining. Trying to make the anatomy of the gingiva look more realistic. And then the technician will place a little finishing line so that the pink ends at a 90-degree angle to give it strength and have a firm distinction between where the pink and the white ends. And now we're going to use different wheels so we can polish this up. We're going to make sure our anatomy is nice and defined. And now it's time to place the pink material. So we're going to first place a bonding agent to make sure that there's no separation of the pink from the white. And we're going to use the pink creoline. There's different materials that have different thicknesses and different colors, so you can be as artistic as you want to make the gums look the color you want and as realistic as possible. We'll use brushes to evenly distribute the material. We can add different layers of material to simulate the attached tissues. And then finally, we're going to place an OptiGlaze over all of the tissues and the teeth to give it that nice shiny appearance to protect the prosthesis from picking up stains and to make it more hygienic. Here's our final mandibular locator fixed prosthesis. We still have the black inserts because we want to try this in to make sure that everything lines up correctly and the bite is perfect before we place the permanent inserts. And here's our final locator fixed prosthesis on the model. Here's our processed maxillary denture. And now we're going to take those same locator abutments from the model, bring them to the mouth, torque them to 25 Newton centimeters, try the prosthesis in with the black inserts, verify aesthetics, phonetics, occlusion, vertical dimension, and get the patient's final approval. Once the patient's happy and you're happy, we can now use the enhanced locator insertion tool to remove the black inserts very easily. This tool is really great. And now we can flip around the end in the handle to the insert side of the tool and then place these inserts with, in this case, we're using all green inserts because when it's 4 implants, we use all green. And then you'll see in the following slides what we do for increased numbers of implants. You always want to make sure you're putting this prosthetic on a foam or a cloth to make sure you're not putting too much stress if it's an all acrylic prosthetic, because you could break these. And now we've placed our green inserts and we're ready to try it in the patient's mouth. Now when we have more than 4 inserts, the greens would be too retentive. So when there's more than 4, we're going to use our tan inserts in the anterior and posterior regions, and we're going to use our blue inserts in the mid regions. When we go to seat the prosthesis, we're going to first just place it with our hands, get it in place so you can feel the inserts kind of engaging the abutments. You can push that down, and sometimes you might hear a little click or feel like it attaches. But in order to seat these, you're going to need to use your insertion tool. So this is a little hydraulic tool, and what you do is you hold the prosthesis down on one side, and you go to the posterior side of one end, and you give it 3 quick clicks. You want to tell the patient they're going to feel a little snap and hear a little noise just so that they don't get startled when you do it. And then you progress to the other posterior side, give it 3 quick clicks, go to the next implant anterior, give it 3 quick clicks, and then the final implant and give it 3 quick clicks. And then you have the patient close just to verify that the bite is exactly the way it was in the try-in when you put it in with the black inserts. And so here's our patient with their final upper denture and locator fixed lower. At some point, we're going to restore the upper implants with an overdenture prosthesis. And here's a post-op x-ray of the housings in place. The little points you see sticking up are those vent holes and the acrylic that's in those vent holes. And here's our happy patient. You can see we made those incisal edges a little bit longer than at her try-in appointment. And here's our before and after. And we always do our final video just to analyze
Page 65,
everything about that case.
66,
66,
Mississippi,
Mississippi,
churches,
Turkey,
judges.
Georgia.
Another big smile. Good. I'll tell her to count to 10.
So in conclusion, we have introduced the locator fixed concept, reviewed the indications for locator fixed prosthesis, presented step-by-step protocols for a patient treated with locator fixed, and demonstrated laboratory procedures required to deliver a locator fixed prosthesis. So I want to thank you for your time. Again, we have many resources with both Zest and Row that can guide you through the process in terms of utilizing this great new treatment that we call locator fixed.